Very good morning. My name is Dr. Arun Kumar, and I'm a faculty of pathology. So today we are going to discuss one important topic in endocrine, which is thyroid hormone imbalances. Okay, so thyroid hormonal imbalances. So in this section, we only have two important things to discuss, which is hyperthyroidism and hypothyroidism. So, what do you mean by hyperthyroidism and hypothyroidism? We know if it is elevated levels of T3 or T4, which is hyperthyroidism, reduced levels of T3 and T4 is your hypothyroidism. These hyper and hypothyroidism are further divided into primary and secondary, which means that you have a primary hyperthyroidism, secondary hyperthyroidism, primary hypothyroidism and secondary hypothyroidism. So before we understand what are the causes of primary, secondary hyper and hypothyroidism, etc., we need to know something called as a hypothalamic-pituitary thyroid axis. Okay, so what do you mean by hypothalamic-pituitary thyroid axis is that we know that we the thyroid hormones are actually synthesized based upon the stimulus it is receiving from the hypothalamus and pituitary. So what is that axis? So you have something called as a thyroid regulating hormone. This goes into your anterior pituitary, and this will secrete thyroid stimulating hormone. This thyroid stimulating hormone will go to your thyroid gland, and this will produce your thyroid hormones, which is T3 and T4. Once enough levels of T3 and T4 are produced, there is a negative feedback phenomenon where these T3 and T4 will inhibit your TSH and your TRH. So this is your entire hypothalamic pituitary thyroid axis in detail. So depending upon the anomaly in this axis, you either have a primary or a secondary disorder. Okay, so which we are going to discuss that in detail. So remember, when we are discussing about primary, so any primary is something where the defect lies in the gland we are discussing, in the organ or a gland. So here we are discussing about thyroid gland, right? So primary hyperthyroidism. Okay, primary hyperthyroidism, it means that, okay, so you are having elevated levels of T3, T4. That is why you are having hyperthyroidism. Primary is because these elevated levels of T3, T4 are due to some anomaly in the thyroid gland. Okay. Now, when comes to secondary hyperthyroidism, here also you are having increased levels of T3 and T4, but the defect lies outside the thyroid. So this is very important to remember, because when you're solving MCQs, you need to understand what are they asking specifically. If they are asking primary hyperthyroidism, secondary hyperthyroidism, primary hypothyroidism, or a secondary hypothyroidism, etc. Now, what are the most important causes of primary hyperthyroidism? Okay, so most common cause of primary hyperthyroidism is your functional adenomas and Graves disease. Okay, so these are actually depends, excuse me. So it actually depends upon the area as well. So when you are discussing about the very developed countries, then the Graves disease is actually predominant thing. Few textbooks also say functional adenomas, but I would say, depending upon the option, go with the Graves disease more than adenomas. Okay, so that is one thing you need to know about most common cause of primary hyperthyroidism. Next, what are the causes of secondary hyperthyroidism? So here I said the defect is lying outside the gland. So either it could be a TSH producing adenoma or a TRH producing adenoma. Okay, so TSH producing adenoma or a TRH producing adenoma are one of the few causes where you actually see the secondary hyperthyroidism. Now we will see what are the causes of primary hypothyroidism. Okay, so primary hypothyroidism, as I said, primary hypo means the defect is within the gland, because of which there is a reduced T3, T4. Okay, Then what is the cause of most common cause of primary hypothyroidism? The most common cause is Hashimoto's thyroiditis. Very, very important. Hashimoto's thyroiditis or any infiltrating disorders are the most common cause of primary hypothyroidism anywhere in the world. Apart from that, TB is another important cause to remember because it's endemic in Asian countries, especially in India. It can cause primary hypothyroidism by infiltrating and damaging the thyroid gland. Other causes are, you can say that there is a non-functioning adenoma, okay, or you can call it as a cold nodule, okay. So what do you mean by cold nodule? Actually, this in scan, when you give a radionuclide, the nodule will not take up anything, okay. So this cold nodule is another cause where see, let's say this is your thyroid gland, okay. Now this is a cold nodule. So what happens is that as the size of this nodule increases, it will go and compress the adjacent normal thyroid and it will destroy the adjacent thyroid tissue, because of which over the time you will have a reduced levels of thyroid hormones, okay. So that is another thing to remember. Then you have something called as a secondary hypothyroidism. So here either you could be having a reduced TSH production or reduced TRH production. So one thing which differentiates a good student from a great student is to have a review of all these things in a tabular format, so that it will be very easy for you to quickly review when exams are coming, okay. So we will quickly make a table how are the lab parameters, okay, in various thyroid disorders, okay. So we'll have a T3 T4 here, okay. We have a TSH here and we'll have a TRH here, okay. So remember, anything which I am actually circling with red, that is the primary event, okay. So primary hyperthyroidism, okay. Here, as I said, your gland is producing more and more amount of T3, T4. So, because your gland is producing more and more amount of T3, T4, this negatively will inhibit the TSH production and the TRH production. So, this is one thing you need to remember about primary hyperthyroidism. Now, coming to secondary hyperthyroidism, as I said, there could be either a TSH producing adenoma. Let's say if it is a TSH producing adenoma, this TSH producing adenoma will have elevated levels of TSH that will go and cause increased levels of T3, T4, and negatively it will inhibit TRH levels. Okay, so these are the lab parameters in a TSH producing adenoma. Now, let's say if it is a TRH producing adenoma, here what happens? You will have an elevated levels of TRH, which will go and stimulate your TSH, because of which you are elevated levels of TSH and you are having an elevated levels of T3 and T4. So these are the important distinguishing factor. Based upon the lab parameters, you can actually say if it is a secondary hyperthyroidism due to TSH producing adenoma or a TRH producing adenoma. So what is that? You will have a elevated levels of TRH and TRH producing adenoma, but you will have a reduced levels of TRH and a TSH producing adenoma because of a negative feedback phenomena. Now we will see what happens when you are seeing a primary hypothyroidism. Okay, so primary hypothyroidism, so same values here as well. You have T3, T4, we have TSH, we have TRH. Okay. So in case of T3, T4, because the glandular defect is what is responsible for primary hypothyroidism, you have a reduced T3, T4 production. That is a primary inciting cause. Because you are having reduced T3, T4, your TSH is elevated and TRH is elevated because of a negative feedback. Now, what about secondary hypothyroidism? So in case of secondary hypothyroidism, so either it could be a defect in TSH production, or let's say you are having a pituitary stalk dissection, or let's say you are having a non-functioning adenoma in a pituitary. What is happening? It is going to enlarge and destroy the adjacent normal pituitary gland. So if you are having a reduced TSH production, ultimately this will also cause reduced T3, T4. Because of reduced T3, T4, here you will have an elevated TRH. Okay. Now let's say you are having any defect in the hypothalamus itself, where your TRH itself is not producing. Because your TRH is not being produced, you will not have TSH. Because your TSH is not being there, you will not have T3, T4. Okay. So based upon the assays of TSH and TRH, you can say if the defect is lying at the level of pituitary or if the defect is lying at the level of hypothalamus. So these are the important laboratory parameters one should actually know in case of primary hyperthyroidism, secondary hyperthyroidism, primary hypothyroidism, and secondary hypothyroidism. Now, there is one additional catch I would like to tell you, what is known as a subclinical hypo and hyperthyroidism. So, what do you mean by subclinical? It means that your thyroid normal hormones are actually normal, but your TSH assays are abnormal. Okay. So, TSH assays are equivalent to your hyper or hypothyroidism. Now, what do you mean by that? So, let's say I am saying subclinical hyperthyroidism. Okay. So in case of subclinical hyperthyroidism, what I'm going to say, I said T3, T4 will be normal, right? So you have a normal T3 and T4. And what did I say? TSHs are equivalent to hyperthyroidism. So what do you actually see in case of, what are the TSH levels in case of hyperthyroidism? You have a reduced TSH. So this is what the lab parameters are seen in case of subclinical hyperthyroidism. Then what about subclinical hypothyroidism? So in case of subclinical hypothyroidism, same, your T3, T4 are actually normal T3, T4, but TSH are same as that of your hypothyroidism, where you have an elevated levels of TSH. Okay, so these are the important things you can actually differentiate in a question, and find out the correct option with respect to different thyroid disorders. Okay, that's all for today. Thank you.